most people are afraid. Like if you're watching this, you're afraid. You're afraid of the world because you're afraid of your mind. The fear that human beings have of the world is really fear of their mind. Now, the more rare you are in your levels of mental health and psychic pliancy, the less you're going to be victimized by that very typical human pathology. The more you're going to be free with it, and the more you're going to be able to dance with it. But I'm not just saying it for the sake of it. One of the most extreme expressions of feeling afraid about the content of your mind is when you're presented with illness that is somehow connected with either fatal outcomes or outcomes that are dramatically life-altering or outcomes that induce a lot of suffering. And when you come across an illness like that, it's scary anyway, but it's even more scary when it's an illness for which the culture hasn't given you resources. If you're the average person, yes, you are shit at talking to somebody who has got terminal cancer, but you could kind of try, and you've got a few concepts from the papers, from your social circle, from YouTube. You can kind of put together and make a couple of interesting questions to that person, hear them, ask them a few more questions, empathize, and so on. You're very insecure in all likelihood when you talk to somebody with a terminal cancer diagnosis, but you are sort of gingerly capable of proceeding. But when you get presented with somebody who is, let's say, 95% bedbound with ME, and they are in a kind of jail of extreme symptoms, whereby they are in agony and yet they don't move. They can't run away from their agony because they can't move. That's really, really, really difficult to empathize with. You're scared of doing something wrong, asking the wrong thing. If you can talk to them at all, let's say 5% of a day they can communicate. What do you say? You're scared to hurt them. You're scared to misunderstand them. You're scared to get it wrong. You're scared to be like 700 miles off in your understanding of this. You're scared that this could happen to you, but you don't want to be consciously acknowledging that to yourself. You are scared that fully taking on board the reality of what that's like would destabilize you, not just because there's a small chance that it could happen to you, but because the very idea that that happens is pretty destabilizing. So, you're going to be directed toward fear of the unknown and fear of death. And these are two things, if you're the average person, that you're running away from. So it's incredibly difficult to empathize with people with chronic illness. And it's important that this understanding goes both ways. It's important that if you want to feel a bit cultured, you understand a little bit the arts, you understand a little bit politics, get yourself also to understand the experience of disadvantaged humans, because their predicament is a very essential part of human life from which we can learn a lot too. So you got to get better, you got to try. But also chronically ill people have to understand how difficult and how scary it is for others. When you've been through absolute hell, you're used to facing certain things that are hard for other people to even talk about. And you've got to have that empathy that, if you have severe ME, it might be quite easy for you to understand somebody who is in absolute hell with some kind of disability. But it doesn't follow it's got to be easy for a healthy person who's never really done it, never really gone there. It's difficult for them. So sick people have to acknowledge that it's difficult for healthy people to understand them, especially if they have scary, complex, misunderstood, and difficult to grasp illnesses. And healthy people need to realize that they're absolutely terrified and they need to dance a bit more with that fear and thereby engage and feel more connected with all of the dimensions of human experience. So this is always a difficult, act of communication, and I think it's important for us to appreciate that it's always an achievement when it goes well between two people, one from the world of the well, one from the world of the ill. And also, well people tend to not understand that there is such a thing as the world of the ill. They tend to think that, especially because the times when ill people see well people, they are seeing them in a more stable moment. But it's often the case that ill people are visiting the world of the well from another world to which they actually on balance really don't want to return, but where they'll be forced to return by the tragic contingency of life. And so, especially in the case of illnesses which are very symptomatically labile, right? You can be in hell for 24 hours and in a more easeful situation for the next 24 hours with ME. Not easy, but relatively easier. It's hard for people to grasp, right, where your world's at. They want to judge it by the presentation you make. And it's important to both understand what that misses, but also to be compassionate of it. Now, my standards in personal life are very different to my standards as a very minor public intellectual on my YouTube channels. In personal life, I'm probably going to ask you to understand me. In my role as a public intellectual, I have a very warm relationship that's filled with gratitude with my community. And quite frankly, I'm not motivated to correct my community when they say something positive toward me that doesn't quite capture things right. Like I'm dealing with a 21-year-old illness that's being now added to by a second illness that's in some ways worse at the level of volatility and extremity. And every time I sort of bounce back from a difficult moment and do a few more regular chats, people say, "So glad you've recovered." And I'm not going to challenge that. And so when I talk about challenging that in this chat, I'm not actually wanting to improve the feedback I get from my community. I just want to have a conversation to the side of that. I'm talking to you, right, about how healthy and sick people can communicate. If I began making demands of my community about how they should relate to my condition, it would feel really weird because I wouldn't be doing thought leadership then. I'd be pursuing, I don't know what, some kind of just reciprocity. No, I'm not pursuing just reciprocity. I'm trying to give people something that they can use a bit emotionally and intellectually to make their cultural, political wherewithal go better. So it's important that I don't confuse the waters here, both pragmatically but also even motivationally, right? So when I see positive comments from my community, I don't want to correct them in the way that might be implied by a talk like this about the ways in which healthy people don't understand sick people. Now, I think that when it comes to sick people, the place of trauma is also very important. Trauma has become a slightly abused word in our culture. It's had a little bit of concept creep. I'm actually okay with some concept creep, but trauma for me needs to be quite a significant thing that persists across some time and expresses itself in mental states that are strong enough to leave very significant physiological imprint and so on. If that's the case, maybe we can talk about trauma. But it's very important to understand that there's a lot of trauma in the chronic illness community for two reasons. A, these people are really, really ill and scarily ill, and they're ill in a way that makes their future both terrifying and uncertain. And then also, secondly, especially if they have an illness like ME or long COVID, society tries to pretend on the whole that these illnesses don't exist. And that can be traumatizing too, when the medical system doesn't have the concepts to, properly understand your experience, when research is left to a few heroic scientists here and there, but it's dramatically underfunded, when there's a lot of prejudice about. And I think that having a lot of trauma can also undermine an ill person's capacity to be understood by a well person. They can say, in response to a well person who is not understanding them because they're terrified, you're just an ableist moron. And I think that there is place for ableism as a prejudice you recognize, but there's also been a lot of concept creep with ableism. I have been accused of ableism by people, for instance, for talking about illnesses like my own as a tragic matter, as something that's very bad, as opposed to something that's, in some postmodern way, neutral and would be okay if everybody else was sick like me too. I mean, some extraordinary woke bullshit here. Get it much more in the United States. Literally, sick people who are in pain claiming that being sick and in pain is a version of being normal, and it's only abnormal in a society that's constituted by oppressive capitalism. Unbelievable bullshit. But so there's some creep around ableism, and we've got to be careful that we can label things as ableist when it comes to social arrangements, policies, the hermeneutical environment in a society, what concepts a society has recourse to when describing experience of illness. But what you really don't want to do is call ableist somebody who is running away from understanding what you're going through because they're terrified. It doesn't help. Ableism implies a power. Doesn't imply, but ableism tends to go with the idea of a power disbalance, where there is a more powerful person who can't be bothered to understand, right? But when some healthy people don't understand me, and I'm an extreme example, admittedly, with the disbalance of my physical health being really shocking and my mental health also being shocking, but in a positive way, people are running away. people are scared. Now, none of these are people who are close to me, but just humans out there are scared. They run away. I'm not going to label them ableist because, quite frankly, they are not able themselves to do some things. And so in some ways it'd be ableist of me to call somebody who, as soon as you present a chronic illness to them in a fully fledged psychological way, explain what it's like, if they immediately poo themselves and start, running away, it's ableist of me not to recognize that this is hard for them. So what's easy for some is difficult for others. What's difficult for some is easy for others. Well, let's now say a little bit, having had this discussion. You know what? I am going to actually postpone the conversation about me to another time, because I think this could go on for 40 minutes and I need to just take care of my health at the moment. And I also think this is a nice slice of discussion. We shouldn't blend it with other topics. So this has been a chat about ill and healthy people talking together. It's been from a position of me lying here, sweating in a lot of pain, with shooting pain in my left arm and chest pressure and pain resonating all over my back and temperature control problems and about 10-20 ME symptoms. So given that I'm quite impressed by my cognitive clarity in this chat, if that wasn't the case, the cognitive clarity would be pretty crap. But I hope we came through with a bit of useful content for understanding. Let's love till next time.